All right, folks, we'll go ahead and get started. It's about 2 o'clock. So my name is Anna. I'm the speech therapist here at Lanier Village Estates. I see some familiar faces out there, but for those I haven't met, my role here at Lanier Village is to basically cover from the neck up. So I cover swallowing disorders, voice disorders. Obviously, I cover speech, language, word finding, and then also I cover cognition. So today we're going to be focusing on cognitive health and how to holistically support your brain health as you age. So when we're considering our brain health, there's no one single thing you can do to support it. It's really a combination of lifestyle factors that will help you age successfully and protect your brain. So we're going to be taking a look today at physical health and exercise, diet and nutrition, cognitive activity, and social engagement. So first, we'll go over 10 quick ways that you can love your brain, and then we're going to dive a little bit deeper into each of these. So number one, break a sweat. Everyone's favorite. Physical exercise is very important for our brain health. We also want to hit the books. We want to stay lifelong learners. When we are learning, we are enriching our brain. We are challenging it to stay active. Butt out. I don't know if we have any smokers in the room, but if we do want to try to minimize that or cut out that habit, as that can increase our risk of cognitive decline. Follow your heart. Taking good care of your cardiovascular health is crucial for maintaining your brain health. Heads up, protecting your brain. We want to do what we can to avoid physically damaging our brain. Fueling up right. Making sure we're paying attention to our nutrition and hydration, catching some Z's, making sure that we are getting adequate sleep every single night, taking care of your mental health, so being aware if we're beginning to show signs of depression or anxiety. Buddy up, meaning we want to stay social as we get older. And stump yourself, that is my favorite one. We want to continue to challenge our brains every single day. We want to make our brains do something really difficult every day. So let's dive into those a little deeper now. We're going to cover how to protect your head first. I don't think many of us in this room are doing contact sports anymore, so we don't have to worry about that. But we do want to do what we can to prevent falls. That's a very common way adults above the age of 65 sustain brain injuries. If you fall in just the wrong way and bump your head, you could wind up with a concussion, a traumatic brain injury, a brain hemorrhage. And we know that repeated falls and hits to the head can have a cumulative effect. So how do we prevent falls? Number one, I'm going to say this a lot, physical exercise will help you maintain your strength and balance. If you are noticing changes in your balance or strength, it's so important to be proactive about that. We don't want to wait to pursue therapy to help with that until after the fall. We want to try to address it before a fall occurs. Within your home, we want to look at your environment. Is there anything in there that could increase your risk of having falls, right? A common one is area rugs, tripping up over the edge of them. Electrical cords, chargers, if those cords are in the pathway. And even as simple as your lighting in your home. We may want to consider installing additional lighting maybe closer to the ground so that when you are getting up in the middle of the night to use the bathroom, you're a little bit foggy because you're just waking up from a deep sleep. That's when you're going to be at a high risk for having a fall. Lighting can go a long way to reduce that risk. If you do fall and bump your head, go get checked out. Just flat out, go get checked out if you bump your head. It's better to catch that early than to wait until it becomes a significant problem. Continuing on with staying physically active, we know that physical exercise, if we are consistent with it, it can lower our risk of cognitive decline. Why is that? When we elevate our heart rate, we are increasing the blood flow to our brain. That's like good nutrition for our brain. But it can also decrease our risk of developing other conditions like high blood pressure, obesity, diabetes. We know those conditions have a higher rate of developing dementia. other aspects of taking care of your health. We want you to visit your doctor routinely. I don't know if you've ever heard the phrase, an ounce of prevention is worth a pound of cure. But if we can catch health issues, even chronic health issues early, and we can resolve or manage them, that's going to go a long way in protecting your cognitive health. So get your numbers checked routinely, get your labs done. If you have diabetes, make sure you're managing it well. We mentioned this before. If you smoke, consider stopping. It's not good for your brain. We also want to be mindful of our stress levels. Life can be stressful. It's easier said than done. But doing your best to find things in your life that bring you comfort, that bring you joy. And if you're struggling to reduce your stress, talk to your doctor. Sleep is crucial for our brain health. The more that we are learning, especially about dementia, the more we are seeing a correlation between our sleep hygiene and our risk of developing dementia. It's kind of up in the air. It's kind of like a chicken and the egg situation. We don't know which comes first, but we do know that when you are asleep, your brain is still active. That is when your brain is recovering from the day. It's clearing out all those waste products from the day. So if you're not getting adequate sleep, you're at a higher risk of your brain not being able to function the way that it's supposed to. We want to also avoid excess alcohol, and then be mindful of your mental health. Depression and anxiety are extremely common, and depression doesn't always look like being sad. For many people, it looks more like a loss of interest. You don't find things interesting or enjoyable anymore, and so you begin to withdraw. Some symptoms of depression can actually mimic symptoms of dementia, so we want to be on top of that. As far as nutrition, there's no one specific diet that's recommended. There's some research that indicates a Mediterranean diet can lead to a lower risk of heart disease, but in general, we want to stick with a heart-healthy diet. So this is a diet that is typically lower in saturated fats, high in fruits and vegetables, good protein, whole grains. So I always say, trying to stick to whole foods, avoiding highly processed foods that have a lot of those saturated fats, and avoiding foods with a lot of added sugar. Not that you have to cut them out completely. I love my sweet treats every night, but just being mindful of that. So staying mentally and socially active. Our brain is like any other part of our body. You use it or you lose it. So if we get in the habit where we are not challenging our brain, over time we may see more difficulty with our short-term memory, with our attention, with our processing, our word finding. The best thing you can do to combat that is simply keeping your brain active. So what are some good cognitive stimulation activities we can do? Learning. If you can learn a new skill, maybe go back to a hobby you had in your youth and pick it back up again. Sewing, knitting, woodworking, learning a new game, a card game. Anything that involves learning a new skill is a great exercise for your memory. We also encourage engaging in formal education. So we do offer classes here through Brenau. I believe they're called bully classes, where you can attend a course. And I know in the state of Georgia as well, adults above the age of 62 have the opportunity to audit college classes for free. So you don't get a grade for it, but you get to go be a part of it and learn, which sounds more fun to me anyways, no tests. But that can be a great way. We want to encourage lifelong learning. We want to find things that you enjoy though. I never want cognitive activity or cognitive stimulation to feel like homework. It should be something that's enjoyable to you. So it might look different person to person. Socializing. It doesn't matter how introverted you are, we are all humans at the end of the day, and we need community and we need social interaction, especially as we get older. We're not going out to a work environment every day. We're naturally getting a little bit less. So you can socialize in a lot of different ways. For some people, that might look like volunteering. There are plenty of volunteer opportunities here at Lanier Village, but also many around the Hall County area. You may want to join a club, a mahjong group, a card group, a book club. There are so many opportunities here. If you're struggling to find your social group, I'd strongly encourage you to reach out to the Life Engagement Office. So, that was what we can do to maintain our brain health. The other aspect that I want to talk about today is dementia. I often get questions, what is dementia? How do I know if I'm getting dementia? What can I do to prevent it? What does it look like? So dementia is an umbrella term. It's not one specific disease. It describes a collection of symptoms that are affecting your ability to engage with your day-to-day activities. The most common type of dementia that I'm sure most of us have heard of is Alzheimer's dementia. This makes up about 60 to 80% of dementia cases. I believe the most recent statistics I've seen were from 2024 from the Alzheimer's Association, which indicated that there are about 7 million adults above the age of 65 living with Alzheimer's in the United States. And another institute said there's about one case of dementia of Alzheimer's diagnosed every 65 seconds. So it's quite common. However, it is not a normal part of aging. So the greatest known risk factor, unfortunately, is being above the age of 65, right? We can't control our age. That's just one of those risk factors we can't control, which is why it's so important to take into consideration the other lifestyle factors we discussed earlier. What are some warning signs of dementia or Alzheimer's specifically? We're looking for memory loss that disrupts daily life. This can look like challenges in planning or problem solving, difficulty in completing a familiar task, something you used to do no problem, all of a sudden you have no idea how to get started or how to continue it. Confusion with time or place, maybe showing up to appointments on the wrong date, getting your dates mixed up. Trouble with understanding visual images or spatial relationships. With Alzheimer's, it does affect how our brain is interpreting what our eyes are seeing. So at the beginning of Alzheimer's, our visual field starts out totally normal. As it progresses, it slowly closes in to eventually, this is about all our brain is interpreting. New problems with words in speaking or writing. Oftentimes this looks like we know exactly what we're trying to say up here, we just cannot get that right word to come out. It's extremely frustrating. Misplacing things and losing the ability to retrace the steps. Decreased or poor judgment, meaning maybe we're making some unsafe choices, we might be having falls frequently from making, unsafe decisions. We might see a withdrawal from work or social activities. And we might even see changes in mood or personality. So people tend to panic when I list those off because they go, oh my gosh, I lose things sometimes. I forget words sometimes. Don't panic. There are some typical age-related changes we are going to have to our cognition. If we're lucky to live long enough, we're probably all going to struggle just a little bit with our short-term memory, with our word finding. So some examples of typical age-related changes are maybe making a poor or unsafe decision every once in a while, maybe missing a bill occasionally, forgetting which day it is but you remember later. You might forget what word you're looking for sometimes, but you're able to work around it or it comes to you later. And then if you lose something, you're typically able to retrace your steps to find it. That's normal. What do you do if you notice or you have concerns that you may be starting to experience some cognitive changes? Don't panic. It doesn't mean it's dementia. The first step is we want you to see your doctor. They're going to rule out a host of other things before pursuing any sort of dementia diagnosis, right? I've seen oftentimes vitamin deficiencies leading to difficulty with cognition. UTIs, undiagnosed UTIs can mimic symptoms of dementia. Depression and anxiety can mimic those symptoms. They may also check your thyroid level. So they're going to check out a bunch of things and even medication side effects. So they'll do kind of a review of your whole system and identify anything that might be causing those symptoms. If they have concerns beyond that, they may refer you to a neurologist or a neuropsychologist for additional testing. I often get referrals for cognition here at Lanier Village. So the role of speech therapy, not just for Alzheimer's, but any sort of cognitive changes that are giving us difficulty. The role of a speech therapist, number one, we're going to do a standardized evaluation. This goes a little more in depth. I'm sure we've all done the cognitive screener in Angeli's office, the slums. This one's a little bit more in depth, and it actually compares you to adults of the same age. So we're not looking for perfection, we're looking for what's typical for your age. We're going to identify what are your strengths, what is challenging you, and we're going to classify if it's a mild, moderate, or severe difficulty. So the areas that we cover: attention, memory, sequencing, problem solving, word finding, executive function, all of that stuff. The goal of our therapy is to keep you as independent as possible for as long as possible. So if you begin to have trouble with your short-term memory, memory is a fickle thing. We may not be able to restore your memory, but the goal is to teach you how to compensate for it. We want you to stay independent with all of your activities. So let's say if you're struggling with keeping up with your appointments. You've always used a paper calendar, but suddenly you're missing appointments. It's too much. In therapy, what it might look like is learning how to use your phone calendar or an Alexa so that it gives you that prompt or a reminder at the time of an event, right? It gives you that tool to use. So we're really going to teach you how to cope with those difficulties so that you can maintain your independence long term. The other aspect that we do is we ensure that when you leave therapy, that you know exactly what activities you should be doing for your brain to exercise the areas that you're struggling with. So if you are struggling with word finding, when you leave therapy, you will have a whole list of things that you can do to intentionally exercise the language parts of your brain. If you know or love someone with dementia, these are some strategies we can use to support our communication. So anyone with dementia, they are still themselves, and we should always presume competence. Even if they struggle to communicate with us, to get their words to come out, they may not remember, we are always going to presume that they understand. So what we're going to do when we're communicating with someone is we're going to try to reduce our language. Instead of speaking on and on and on, we might try to keep our sentences to about 4 to 5 words and give the person's brain time to process what we've said. We're going to check in to make sure they've understood what we've said, and if we need to, we might repeat that information. If we're asking a question, we're going to avoid open-ended questions and instead give choices. So if we're asking them, what would you like to eat today for lunch? That's a lot to process, right? Versus if we ask, would you like the chicken or the beef for lunch today? We've given 2 choices. That's much easier for the brain to process. We might use written cues, writing things down for the person. If we go to visit them, we might write down, I had a great time with you today. I look forward to seeing you next week, so that they can look back at that note and remind themselves, oh yes, John came by to see me today. So our last section here that we're going to go through is a cognitive screening. So I want you to think through these questions, and if you can identify 3 areas that might be giving you trouble, that could be a sign that you may want to pursue seeing your doctor or consider a therapy referral. So I'm going to give you a few minutes to read through those, and then we're going to open up the floor to more of an open discussion. Can you see them okay? Okay, I'm going to read them out loud. Do you have more trouble remembering things that have happened recently than you used to? Do you have more trouble recalling a conversation a few days later? When speaking, do you have more trouble finding the right word or tend to use the wrong words more often? Are you less able to manage money and financial affairs, e.g., paying bills or budgeting? Are you less able to manage your medications independently? And do you need more assistance with transportation, either private or public? So if some of those are areas that you can identify that you're struggling with a bit, that can be your sign that, okay, I may want to consider talking to my doctor or pursuing a therapy referral. So I'm going to open up the floor now. We've got about 10 minutes. I'd love to, if anyone has any questions, I'd love to go through those. So my manager, Sherry, back there has a microphone she can pass around. Anyone? Okay, and is there anything that I missed that you would like to go through or go over?
You had to swallow the listed oil.
I did. So, we'll go back. Speech therapy also covers swallowing disorders. The reasoning behind that is we kind of became the experts of all the anatomy for speech and voice, and so it kind of made sense for us to take over the swallowing aspect as well. When we have a progressive condition like a dementia, in the later stages of that, we will often see swallowing difficulty. So the brain has a hard time communicating with the muscles to tell them what sequence to operate in. So they can start to get a little bit mistimed and increase the risk of aspiration, which is food going down into the lungs, food or drinks. The other aspect is sometimes with those later stages of dementia, people can begin to have a harder time recognizing when something is in their mouth, right? So they might start holding on to food or pocketing it in their cheeks. So that's the role of speech therapy, is to make sure that people are able to eat and drink safely. Swallowing disorders don't just happen with dementia. It happens to all sorts of people. It's extremely common. It's about 50% of what I do here at Linear Village. Many people, you know, you can imagine if all the other muscles in your body are at risk of getting weaker as we get older, there's a lot of little tiny muscles in here that can get weak as well. So for speech therapy, the first thing we'll do is we want to send you for imaging, where they'll have you eat and drink under an x-ray basically, so we can see what exactly is going wrong. From there, ideally, we want to rehabilitate those muscles. So there are actually exercises we can do for these muscles. I'll give you guys an example just for fun. Put the tip of your tongue between your teeth, hold it there, and try to swallow. A little tricky. That exercises the base of tongue, okay? That's just one example. So some signs that you may have a swallowing disorder: if you're frequently coughing during your meals or clearing your throat during meals, if you feel like food is getting stuck, if you're having trouble chewing, all of those are things that I can help with as well. Any other questions? Go for it.
Last one. If your spouse is remembering specific conversations that you don't have any recollection of, how do you know which one of us has dementia?
That's a good question. I don't know that I can give you an answer for that. So she asked, if your spouse is remembering specific conversations that you don't remember, how do you know which one of you has dementia? You know, I always like to say the wife is right, but I'm biased on that front. No, I'm just kidding. That's a good question. I don't know that I have an answer for that one.
Throw it out there.
All right, any questions? Any other questions?
One of the things that we have learned over time in dealing with people with dementia, like my mother and other people, is we don't argue with them.
Mm-hmm.
If they tell us something that we know or we suspect is not right, we just let them talk. We just leave it not argue with that.
That is perfectly correct. So he said that when you are communicating with someone with dementia, we don't argue with them. If they say something that's wrong, you let it be. So I like to call that jumping into their reality. So we have to recognize that people with dementia are doing the very best their brain is able to do at any given moment. They cannot be flexible the way we can with our brains. And the way that they are interpreting the world around them is different than the way that you and I do it. So it's really counterproductive if we try to correct someone when they have dementia. Because in their mind, no, I'm right. You know, it would be like if I told one of you, oh, you're wrong about that. That didn't happen. You'd go, yes, it did. And we're really not going to get anywhere productive. So when we're communicating with a loved one with dementia, we always want to have kindness at the top of everything. It's not about being right. It's not about correcting them. The most kind and loving thing we can do is let them. If they say something wrong, go along with it. If, you know, I've had instances where I had a client one time who around 4 o'clock every day would start looking for her mom. And she was in her 90s. You know, her mom had passed away 40 years ago. But every day she would go around, wheeling around looking for her mom. It's not productive to tell her, your mom passed away. She's not coming, right? That would just be a heartbreak all over again. It would be like losing her mom all over again. So instead, what we do is we jump into her reality. I'd go up to her and I'd be like, oh, well, I think she's still at work right now. Tell me about your mom. What's your favorite thing about your mom? Because the underlying communication need there is, I miss my mom. I want my mom was my comfort. I miss her. I want her. So engage them about their mom, right? Tell me all about her. What do you like to do with your mom? We're still meeting that need, but in a very kind way.
I have a buddy in Willowbrook, and one day I went in and she was grieving over the loss of a child from years and years ago. I mean, he was 11. How do you work with that?
Well, so for those who didn't hear, she said she went into Willowbrook one day and someone was grieving over the loss of their child that had happened many years ago, many years ago. That grief in that moment is so real to them. And oftentimes with dementia, it's almost like we're going back in time, right? We're not remembering the new stuff, but we can always remember the things that happened in our childhood and early adulthood. So the best thing you can do is allow them to grieve the way that they would if it had just happened. I'm so sorry. Tell me about your son. And engage them. They're missing them in that moment. So just acknowledge it, accept it, and then once you've addressed it, you can try to redirect. Well, why don't we go sit outside for a little while? Let's go sit in the sunshine. Let's go listen to some music, and we can try to redirect. But we always want to address that initial emotional need first. And I saw we had a question over here.
To strengthen the throat muscles, do you ever refer your patients to the LVE chorus?
I have made that recommendation before. Yes, I have. Singing is a great way to maintain your laryngeal strength. So I've had people from LVE chorus actually come to me. Something that can happen with our voice as we get older is called presbyphonia, which just means your voice is getting older, so your vocal cords are starting to atrophy some, and they're starting to bow out, causing kind of a thin or weak voice. Maybe we're not as loud as we used to be. So I consider my relationship with LVE chorus symbiotic. You know, we kind of refer back to each other, but if you are experiencing that, we do have a program for the aging voice. It's one of the only, actually it is the only program that's been studied through a randomized clinical trial specifically for presbyphonia to increase the muscle strength of the larynx.
I'm just curious, is that a doctor referral?
Yes.
Access that, okay.
Any sort of therapy, we're going to need a referral, and specifically for voice, we will also need an ENT referral, or at least an ENT consult, just because I can't treat what I can't see. So we want to make sure we don't have anything going on more than just an aging voice with our vocal cords? That was a great question. Any other questions?
We need altos, okay?
All right, should I start referring more people to the chorus? Is that what I'm hearing? Okay. Well, I will stick around for about 5-10 minutes after this if anyone has questions they'd like to come up and ask individually. Otherwise, we are all finished for today. Thank you so much. You all have been wonderful. Appreciate you for coming.